I would like to introduce now our panelists. And I will start actually with Brian. We have here Brian Lee, and he's a senior advisor at the CDC, at the Office of the Chief Information Officer. And he's going to give us his perspective of some of these issues. We also have Professor Sion An. She's a professor in the School of Education and chair of the department. We also have, last but not least, Dr. Ken Goodman, who is also the founding director of the Institute of Bioethics, one of the co-organizers of this town hall, and also a center director for the Data Ethics and Society of the Institute for Data Science and Computing. With that, I would like actually to start perhaps with Brian to discuss a little bit, with the experience that you have as part of the CDC, but beyond that, because you have a lot of experience in this space, what do you think that is the challenges in general of the data, and especially the COVID-19 data? How we can collect this data, and how we can feel, how we can think that we should be thinking about the collection of the data and the harmonization of the data, and ultimately how we make the data more publicly available. You have, what do you think that this is the new challenges in this era that we're living today?
Yeah, so thanks, Nick. I think that's, it's really, I can't state more how complicated and diverse the different data feeds are, and how that complicates and makes it a bit more tricky to identify information of use, to make it usable, and actually put it into action. I think in large part, when we say COVID data, there's so many different domains, and that could be surveillance, it could be capacity, it could be populations, it could be social determinants. It's so diverse. I think one of the large challenges is really trying to prioritize what data is of the highest need, and then also balancing the resources into making it useful, in the sense that the data quality processing can sometimes be challenging depending on the audience, in the sense that the intended audience is a layperson, and having it with a very approachable health literacy level so they can understand it, while also having that same level of integrity and transparency that those who are data scientists or analysts or archivists can still see and understand and trust the entire lineage of the data. And I think that's the same story being told, dozens or hundreds or thousands of times over, depending on the data set and depending on the sources that go into that set. It could be because the sources are distributed across states and counties and cities and jurisdictions. It could be because multiple sources are combined together. And when you do that, you have different stewards and you have different organizations who are trusting each other to create derived products, and how you do that. I know a lot of the work that I've been working on recently, and many of my peers, has been trying to increase the amount of data that we release publicly, that we release for open data and open access. And the challenge is really balancing the trade-off between usefulness of that data and protecting the privacy of the citizens, of the patients that are reflected within that data. And I think that's the challenge of trying to have that done in a computational way, so that increases both the rate and the quality of the data released while still protecting privacy. And I think that's a lot of effort and a lot of sort of smart minds trying to figure out which sets are of the highest importance. And I think frequently it's working with different stakeholder groups to identify those. And sometimes the stakeholder groups are the public or advocacy groups, and it gets to be quite a bit of a challenge to do that. That's helpful. And I'd also be interested to hear some of your thoughts of other sort of complications or interesting or complexities in the data flow and how it's used.
Right. Great. Thank you, Brian. Actually, if I may also actually bring in here a little bit of Ken here into the discussion in terms of the data collection. And perhaps, Ken, can you share some of your thoughts in terms of what it means basically to collect what kind of data? Because we are also facing this. This is useful data. Some people are reporting the data. We have counties that they report it. We have states that they report certain types of data. They report them differently. They report them the same way. There is, of course, an informatics and computational aspect of the harmonization, but also it's an ethical aspect of what we should be reporting in a pandemic era, and what can be useful, and how we can all agree to that. Do you have any, how would you approach this?
So thanks for that, Nick. What I don't know if anybody else, how many people on this call have familiarity with public health and epidemiology. But those of us who get to teach this a little bit love telling the story of Jon Snow. Now, Jon Snow is not a dragon fighter, but in fact is a very important public health figure in the history of science. He was in London actually 2 centuries ago. And he gathered information about where people who were getting sick with cholera lived. And he used that information, he put dots on a map. Brian, he didn't ask their permission, but he put dots on a map saying somebody from this house here had cholera. And by putting lots of those dots on a map, he found out, he believed, where the well was that was contaminating people in that community. We've known, actually, that goes back a century and a half or more, we've known since ancient times that the more information we have, the more lives we can save. The values have always been in some sort of tension, but we have tried, especially given the rise of what we now call public health informatics, to have our cake and eat it too. That is to say, we want to save as many lives as possible. We want to trust, as we all do, our colleagues at the CDC to do that for us. And we want to make sure that along the way that we don't sacrifice something that we ought not to sacrifice. I actually trust Brian with my health record. And that's true for all the many stigmatizing maladies that I have. I may not trust you, Michael, with it, but if we do not create a system, Nick, that follows up on the importance you described and use that information to improve public health, we have committed, I would believe, a terrible ethical mistake. Imagine having lots of information and the ability to save a lot of lives and not doing so. And so that's where our first challenge is. It's a thread from your remarks, Nick, through Brian's. We need high quality data produced by transparent algorithms and managed by trusted brokers who are going to interpret it and communicate it. What we've learned, though, and this comes from actually Brian's old boss at the CDC, we're not doing a very good job of that. In other words, we're not reporting essential data, we're not collecting it properly, we're not sending it to the right place, and we're not analyzing it in a transparent way. Those are really tricky ethical issues that Nick, flow right out of the scientific firmament that you plotted. There are constellations that say how we should do the science. There are values that attach to all of those. We'll be able to talk about more of them as we go on.
Absolutely. Thank you, Ken. And actually, I'm going to bring here a little bit Soyon into the discussion, actually, because she's been dealing with a lot of interesting way of actually standardization of the data. So, Soyon, what would you think from a scientific perspective, right? Why in this COVID, what would be a way of standardization of the data? What would you think in different areas we would need as a scientist to be able to draw some scientific, processes and conclusions that they have some kind of, validity and integrity?
Sure. So thank you. Well, from my expertise in measurement and statistics, my question is more coming from how we gather the data, how we get the responses from the people, and how we are wording whenever we are asking, collecting some survey data or some other social attributes of the data set. And now we see that whenever we are having this COVID-19 going on, the issue that I see more is multiple sources of data that is collected by many other people who might not have been really thinking about how this issue might be making the consequences out of it, and how we are inclusively getting a lot of responses from multiple populations who are having different attributes into the data set, have not been really understood among everybody. That might be really the questions that I am very much into for data collections and data, like multiple sources, how we can harmonizing those multiple data sources whenever those data are collected by different people from different perspectives. That might be the one that I am more curious about, and how we might want to make this to be standardized in a way that we can use those data in more beneficial and sustainable way for the future consequence modeling or algorithms.
Right. Great. So, you touched something that it's actually very interesting, and I see some of the questions that they are actually going on the chat, which is very interesting. I would discourage the panel to look at the chat, but it's very interesting. So, Ken, and I think that and Brian, actually, you touched it a little bit, and you know what Sayan is saying. Who you trust your data with, and for what purpose?
So one of the things that people in computer science have known for a long time, Nick, is that trust. If I'm writing software, or I'm building a database, or I'm designing an interface, and you're using it for something that really matters, you need to make sure that I have done my job according to what used to be uncontroversial ethical standards or rules. Veracity, tell the truth. Transparency, show your work. And accountability, be prepared to explain your work and how you got there. If something goes wrong, which it very often does, then someone needs to be able to take responsibility for fixing it. We live in a time now where trust in civic institutions is not what it used to be. I don't know why some people in Washington don't trust people in Atlanta, but I trust the Centers for Disease Control and Prevention. The fact of the matter is, here's an organization which for years has been a trusted broker and earned that by being, for the most part, apolitical, also been wildly under-resourced. Brian and his colleagues, he may not be allowed in this call to agree with me, but so I'll say it, Brian and his colleagues need more resources. But when it comes to precisely the kind of distinction he made, how do we get lots of data, analyze it carefully, and make it meaningful without violating privacy rights? The CDC has got that, as do many of our health departments and others. So I trust those who in government who have been tried and tested in that way. One of the questions in the chat refers to a number of corporations. I don't think that any of the big IT or tech companies are committed to the level of transparency that our government is. And so anything that's not transparent, including who made the policies about disclosure, is not going to engender trust, which I think everybody agrees is an uncontroversial goal to achieve. So to answer your question, the CDC, and we need to identify more resources. This is not a political, sociological, or an anthropological observation. We want to have as few dead people as possible. And the track record is trust the CDC and give it the resources you need.
And I think that the trust, in my mind, really depends a lot on the data in use, in the sense the higher the sensitivity of the data, the higher the trust you have in the users. And I think in some cases, there's a lot of work that goes into public use sets that are released, in which case you trust the designers of the data, but as far as use, it's intended to be used without trust. In the sense, anyone in the world can read it and use it for a wide variety of purposes. And if we're lucky, they cite us, and that sort of helps other people find that work. But I think when it gets to trust for the collaboration around data collection, the collaboration around the analyses, which frequently have that data sensitivity, it comes down to the training of the different collaborators you have. So the higher the training of the people you're working with, the more trust will be there. And then also the common rules of behavior around how the data are used. So the trust of how I work with someone around data is going to be dependent on the restrictions in place or the agreements that we've made on what can and can't be used and what can be derived, the resolution at which it can be shared. That's extremely important. And then finally, as Ken touched on, the accountability of that use. So I think when you have rules of behavior which come down to having well-trained collaborators, having common agreements and values of how we work with data, having some accountability of what that means in the sense that how do you monitor where data are being used, or how data changes, or when it changes, or who changes. And I think that's incredibly important to the trust in using data, is being able to see where it's been modified or merged. I know Soyan mentioned harmonization. I think this is where trust is extremely important, because the methods of those harmonization, how you link data sets, how you clean data sets, how you harmonize concepts across them, having that method available, and in some cases, I consider that data and treat it as data because the code that goes into the harmonization is in many cases as important or more important than the data underlying, because if you've harmonized data sets, that involves some change, some transformation, and having it be extremely clear what that transformation was and when it happened is I think achieved by being able to share the code and the specific environment that code ran in that linked it. But I think that those factors are important for the trust of how data are used, and it comes down to the individual and institutions working with them. Thanks.
Great, and actually I'm going to change a little bit and bring Soyon in and say, Soyon, how would you approach this in the era of COVID-19, right, where you have perhaps thousands or tens of thousands of scientists and professionals that they're working on this, and also I would say that even the public, the private companies like Google, Apple, the big technology companies that to some extent they want to help, right? But how would you actually being able to harmonize, if you will, the standardization of getting the data, right? So how would be, a scientific approach to harmonize, to get to actually acquiring the data, and how would be to actually, we all agree how we would look at and analyze the data, perhaps, right?
Sure.
From different perspectives.
Sure. So I will, of course, this COVID-19 is the one that we are dealing with. And as Brian said, there are multiple factors that might affect what is happening with us. And we are not 100% sure at this point how things are working, even though we have some hypotheses around it. And many people might not have the same agreements on what is the issues, what are the factors, what we need to add as the variables, and how we might want to process data as is. The one that I can think about from my own experience was I trust the dialogue process with the content expertise. And not only the content expertise, also whenever we are working as a data scientist or statistic person, we come into our data and trying to sometimes guess what the data looks like, or how we are making them to be standardized, how we are making them to be harmonized. And the first thing I might want to do is to try to go with many experts who are in the content area. Not only one person who can be just one source of the data set or one source of the expertise or theoretical background. Having multiple dialogues across the different expertise, out-of-box thinking into different research, looking at how people are seeing the data and how the data was created. That might be the first things I might want to go with it. The example was whenever we started with cancer research, ICD-9, ICD-8, or the other coding previously that we might want to do some harmonizations to the current ICD. It requires quite a bit expertise going into it before we getting into data scientist. So the first thing I might want to do is try to talk to content expertise. Not only one person, we might want to have a dialogue among a lot of people from the multiple angles.
So Brian, we touched all of this, right? And this is all we're touching is that although there are actually pretty, I would say, standard problems that we have in data science these days about all the data and so forth. However, the COVID-19 brings that up into a very interesting perspective, that we have to do all of this that normally in the scientific world may take years to actually in weeks. What do you think that an organization, how you think that we should be doing this, and who should be taking the lead to lead us all basically in that kind of context? Because now the times are compressed, right? We don't have the luxury that we take months to decide to have discussions and how we standardize and so forth. How we do this in this COVID-19 era, and how we do it in a way that we're not cutting corners. How we can do that. So that's.
Yeah, I think you've hit on an extremely important part, which is, we need to make decisions immediately and now because it's impacting, our communities and all communities across the nation. So I think it's that challenge of the urgency of the need for for information and the urgency of the need for quality data versus the challenges of resources in place, and then also resources changing in the sense that different jurisdictions are bringing systems online or improving data, or the formats that data are submitted of have changed over the course of it. And so I think that it's a pretty I see it's a large problem domain. And so I don't think there's a single solution, but one of the things that I think is very important is the understanding and the trust around data lineage, in the sense that as different sources of information may change, and they literally change their formats from a CSV to an API, or the number of sources may change to have more sources come online, or sources to send additional fields, to have a very clear audit trail of when fields changed in the schema, as well as when fields changed and were improved. Frequently, there's a whole supply chain of when the initial report happens to when additional information is supplied to when a case is confirmed, and that record may be improved upon over time. But I think the key is having that lineage that's available at a computational level to be able to not just confirm its validity, but then also to extract meaning from that, in the sense that it may be the metadata of that data changing over time may be important for making decisions out of it. And I think that amidst all the different changes that are happening, one of the key ingredients is being able to have that line of sight and the trust that when a change was made, it's recorded, and that you can be able to roll back through time or to see how those changes occurred. And I think there's a couple different computational ways to achieve that, but it's really about, that's where I talked earlier about the shared trust or uses of the data and the shared behaviors, that when you come to the agreement of how those changes will be tracked and how those changes will be tracked across different organizations, so that you can rely on similar data lineage or similar data provenance across your sources, as well as internally when you're working on it. It's as simple as sort of keeping the raw data received plus the interstitial data that's being processed, as well as the analytical ready cleaned, and having that happen over and over and over on the different data streams that are being used.
Right. So Brian, so a little bit just to follow up a little bit the question, how you can deal this from the perspective that in your position that you have, at CDC and so forth, when the states are reporting data, but in a different type of way. So if you see how Florida reports data versus how Nebraska reports data, how California reports data are completely different. What are the challenges for someone like you in a kind of a national organization that is trying actually to make some kind of sense about all of this and presenting the data in a similar way?
Yeah, I think in some parts, I have colleagues who work on that specific task. So I can't speak directly as to how the different integrations are made state by state basis, other than they're really smart people working on this problem, and they work an immense number of hours every day doing so. But I think that the way that we see it reflected is you have different sources that need to be combined together to have sense made from them, and it's in trying to validate that the sources have similar fields, that those fields are collected in a similar way, and so that you're comparing apples to apples. And I think one of the things is to strongly avoid comparing disparate data that you think they aren't disparate. And I think that it's the being able to understand the sources and then extract the common elements across them. I think it's a challenge, but that's part of what makes the analysis that goes into it so complicated, is that it's not as simple as you get a nice shaped data set that someone's worked on for a decade, and then you run your routines on it. If it was only that nice. But I think part of it is the work that goes into linking and making sense of the different sources and identifying the common elements that can be used.
Mind you, it'd be a lot easier. It'd be a lot easier, if I may, Nick, if we weren't doing this on the fly. We now have a public health emergency of a magnitude we have not seen on Earth in a century. And the idea that we are now, that last week there was a decision made to change the routing of data from the CDC to HHS in Washington. This is a little, for those of you who are not from South Florida, you may not get the metaphor, but this is like waiting for the hurricane winds to get to 75 miles an hour to say, I'm going to go shopping for shutters now. The connection between, but that the science, the data science, We're pretty good at this in a lot of cases. There are challenges and scientists rise to them. We want robust surveillance. We want competent storage. We want high quality analysis. That's what Brian and his counterparts and Dr. Ahn and her colleagues do. Why are we surprised? Why is the United States so terribly behind in these fundamentals of public health data science? There have been people writing articles toward a foundation for a public health data infrastructure for a decade. If anyone's surprised by the pandemic, they haven't been paying attention. I bet it won't be the last. And so we have an opportunity, I would say, moral obligation to make it a little easier for the people we keep turning to pull our fat out of the fire. That would be our public health infrastructure. Give them the tools, give them accurate, reliable data, and create an environment where they don't feel they're giving up something precious like their privacy for the sake of their public health.
Yeah, I think that's a great point. Actually, going back a little bit, and I would like to ask Soyon is actually a little bit on the interpretation and the analysis of the data. Soyon, we all look at the same data set, and we may draw different conclusions.
True. We may draw different.
So how we can combine this? I mean, we are looking. Let's assume that we took care of the harmonization and the collection and so forth. So, explain this a little bit to us. What is happening and why this is happening, and because it's happening not only in the COVID-19, but COVID-19 brings this up. And what does this mean about the scientific process?
Well, so I will say from my experiences that I am also doing meta-analysis, and I'm trying to do meta-analysis methods in my life. And a lot of times whenever I see, those studies having, even though they are looking at exactly the same phenomena, the way they report, the way they do analysis, the way they even make sense of the data itself and process itself are so much different in terms of their data analysis, the theoretical justifications and empirical justifications. And I will say that those are the ones that we have been dealing with quite a bit in terms of, interpretation, data analysis, and even though we are looking at exactly the same things, we are getting into quite different or little bit way of thinking that we also need to make sense of differences on that one. So I will say that I don't think I have really clear a guidance at this point. However, as a meta-analyst who are always trying to aggregate data in a way that I can come up with one solutions and try to look at the apples and apples, I always coming from more about what is the research question, what are really we are trying to answer the questions out of those data set. I think that is the first things I need to think about. And from that one, I can see which one can be combined together so that we can make the sense of whole data as a whole pictures into apples and apples, not like apples and cucumbers. And that might be the way that I'm thinking from my interpretations and data aggregation perspective.
So, Ken, I will try to be a little bit, provocative, now. All right. So that's my role as a moderator. So, tell me a little bit about, you mentioned that, well, we have to go really fast. So, we also have a question here on the chat about contact tracing, which is specific to COVID-19. And in this modern world, we're all connected, and technically, telephone companies, banks and so forth, including our government, can trace us, basically what we're doing, where we spend our money. Amazon, the big tech giants are doing this all the time. So what is happening with the COVID-19 era? How much of that are going to lose basically as in our, will to comply versus the will to actually deal with a pandemic that we may have to have someone surveil us, you know, about and being able to have a more public health, you know, plan. So how can you reconcile those?
So you began by asking about trust. We have a public health crisis which we could manage more if it weren't for the fact that the people who are counting on the scientific community to mitigate this virus were not using devices which we have generally come to find to believe to be untrustworthy. At the end of the day, history will say they could have saved a whole lot more lives if only they trusted the people gathering their data. And there I'm not referring to governments, I'm referring to the generalized sense that everything you do, that the tracing, that people feel that that there's sort of this surveillance going on all the time for marketing purposes, and maybe for other illicit purposes. There are some countries in the world that use the same contact tracing apps for political purposes. And that's terrible. I mean, there are some countries in the world where they actually send government federal troops into cities. Sorry, it's hard to imagine sometimes. What we have now, though, is a crisis in trust. What you've described, Nick, is a situation where I believe that town-gown partnerships, that partnerships with industry are completely possible as long as we set out the proper ground rules. And we identify the ways in which ethics and policy can do that in such a way that there are really strict rules for what any of the big tech companies can do with the data that was collected for public health. There are ways of establishing those ground rules, making it clear that penalties, that violations will be severely penalized, and that we will have the benefit of really robust contact tracing, and at the same time, a mitigation of worries that that same information might be used for illicit purposes. But that's the important role of ethics and policy in trying to help scientists do their job for society.
Great. I mean, I think this is some very interesting aspects, actually, especially with the contact tracing. This is specific to COVID-19. You know, for example, in Italy, the app didn't necessarily work that well because there was not enough compliance from the people. Unlike in Germany, actually, that it worked pretty well in terms of. Just to go a little bit more about this, actually, and talk to Brian a little bit, and get to my last, to the last theme, I think that we would like to touch a little bit. And I know this is just we're only scratching the surface now. Is that what's the responsibility of the scientist, Brian, to communicate the data, and what to communicate, and how to communicate?
And I think that what's interesting now is seeing emerging standards around what those responsibilities are and having them be shared across organizations. So where I work, we're really diverse organizations. There's different centers dedicated to different areas of public health. And I think establishing common standards around how data should be findable, or there's the FAIR principles where data needs to be findable, it needs to be accessible, it needs to be interoperable and reusable. And I think those are being built into the ethical responsibilities of when someone designs the data collection, or when I design an analysis, how do I think about the outputs, meeting those principles and being reused? But then also, are there ways I can affect the inputs, in the sense that in some cases, the difference between inaccessible data and accessible data is the descriptor of it. So there may be data that's difficult to find, even though were it found, it will be very useful. And so I think there's that responsibility of the data user, of the data scientist, of the data analyst, the scientist, not only in how they craft their outputs, but then also if in some way the work that they're doing can make their inputs reusable by their peers.
Great. I mean, and again, let's put it this way, Sion, is that, in the part of the scientific process that we talked before, is that we publish papers, we have peer review of our results and so forth. In the COVID-19 era, all of these kind of things, again, to publish a paper and having your results actually communicated, which is part of the scientific process, and the vetting, we are seeing now science happening through press releases, for example. The scientific process is a little bit too cumbersome, really, for dealing with with a situation like we have now, a pandemic, going through the process of submitting and so forth. How do you think that we should be reconciling all of this? Because that's also part of the process of actually making solid scientific conclusions, which is the peer review, the vetting, and so forth. And I would like Sion and Brian actually to comment on that before we go to
go ahead, Sion.
Oh, go ahead, Brian. So, okay. I will add after you're done, Brian.
Okay, sure. I was just going to say that there's a couple pieces to that, and I think one is in having the data of my question that I'm researching available for reproducibility, and I think that's separate from trying to increase. Although that's positive, I think a lot of the attention and value is in trying to produce these analytical sets for public release for use. I think one of the things that I work on is frequently the authors, the scientists who are investigating a particular question within the data, there are different skill sets for how you would release that data for use, in the sense that a scientist does not have to be a privacy expert to have an amazing hypothesis and explore that. But in order to release data, you have to have confirmation that the re-identification risk is low. And so I think it's combining these skill sets of a PI or a researcher may have different skill sets from a group that needs to assist that person in the release of the data, in the sense that how data are structured for analysis and structured for reuse, those are sometimes different skills. Where there's sort of a bare digital data literacy or data fluency that everyone may have, I think in order to increase the volume and the quality of general research sets available to the public, it's trying to have those PIs who have research questions to collaborate with others who have the skills to either enhance or to describe or to make available. And I know in informatics that frequently can be things as simple as just establishing the system infrastructure to have an API. In the sense, a researcher might do amazing things with the data for their topic, but in order to release it, it has to have an entire sort of cloud infrastructure ready, so you could have that data set be accessed by sometimes very high volumes. And so I think that's the novelty, that it's not just the responsibility of the individuals working with the data, but it's trying to have them collaborate with a broader set of skills, so the data can be used beyond just the immediate purpose for action, which I think frequently that's where the resources are targeted towards, because there's an immediate need to find a question, and then the ability to have that data released for secondary use. Sometimes during a pandemic, there are other drivers that require those same individuals, those same skills.
Well, I'm going to add one more things toward the public. So as a scientist, of course, we will be processing data, collecting data, analyzing data. However, once we get the data is also very much bounded toward the context and geographic reasons and time. And there are multiple other confounding variables that might be making the conclusion to be more complicated. And whenever we come down to the sharing what we found from our scientific research, we also need to give some warnings about those potential confounders that we also need to be cautious whenever we're making the generalizations based upon what's there. The other one was maybe having more lay language that can be translated into what the public can be understanding the results to be. That's also our role as a scientist, to give better visualizations and making the XY scale to be comparable each other, and what is the lay language interpretation of what we figure out from the scientific research. Not only data itself, but more about translations into public will be very needed as well, because at the end, we are all responsible for data collections and all data life the cycles itself. So I would say that's also scientists' responsibility as well to communicate better with the publics.
So with that, Ken, I think that before we go and take a couple of questions actually from the people there, so how we communicate the data from a scientific perspective, as Sion said, right? So, as a scientist, we say, oh, we think that this is it. And then we add a disclaimer at the end that be because of that and maybe that and all of this. How do we communicate this to the public and how we communicate this to policymakers, where yes, it's a scientific process that it leads us to these conclusions, but also there is some important, how can I say, drawbacks and, caveats that, perhaps we always, as scientists, put it together. But sometimes also scientists ourselves are actually the worst, our worst enemies, because we try to make it a little bit too simple, and we wanted to have it as a binary, 0 and 1, right? So, and in this COVID-19 era, I think that can get us into a little bit of a trouble, right? To wear masks, don't wear masks, test, get tests, no, don't get tests. More tests is better, no, less tests is better, right? So.
Well, so once we've determined who we can trust, we know the answers to all of those questions, don't we? You've identified a great challenge, and it's the seam between the scientific method and the importance. I think Soyon talked about this, about reproducibility. How do you communicate probabilistic results to people who buy lottery tickets? In other words, the challenge we face is one of public understanding of science. That we have a problem, it's an educational problem in our country. We are right now solving two of the greatest challenges in the history of civilization. One, this COVID epidemic. The other, at least in this country, but in many places around the world elsewhere, a problem we've discovered that our educational systems, our housing systems, our scientific systems, our medical systems are racist. We're fixing we're trying to, as if it were a problem as opposed to a transformation needed. One of our colleagues, as you know, and he'll be on one of the future webinars in this series, Nick, Professor Cairo, his expertise in how the representation, the visualization of data.
Right.
How do you communicate this information and these data, not synonyms, by the way, to a lay audience? Because at the end of the day, even if the 5 of us, or the 100, however many of us on this call have all got it, the populations that protection matters the most need to understand it as well. And we've done a terrible job, that's the collective we, when it comes to something as simple as wearing a mask. The idea there are people who've actually somehow acquired the belief that somehow or other wearing a mask is onerous in public or deprives them of some liberty, not only is an ethical knee slapper, but it also has a body count to correspond to it. It's against that background that we're trying to communicate really nuanced scientific concepts. It means working with people like our colleague, Professor Cairo, working with the news media, and for scientists to do a much better job communicating with each other and with lay audiences.
Great. So actually what we can do now here is that, and Michael can help me a little bit here, is that we can take a couple of live questions from the audience. So Michael, do we have someone who, I think that there's a lot of questions in the chat. So
yeah,
I think it would be great if we have someone actually posing a question and someone.
Sure. This question comes from Prim. How do we overcome the lack of public health resources to implement well-informed, data-driven strategies? For example, if Jon Snow, who Dr. Goodman mentioned earlier, didn't have the resources to fix the identified contaminated well in London, the analysis he did wouldn't have been fruitful. Like maybe Dr. Goodman would like to address that.
The account, yes.
Interesting. So right. So we either you value public health or you don't. Right? I mean, it seems to me to be a really simple one. If your only goal in civil society is to contribute as little as possible, including, for example, through taxation and paying taxes, then you're not going to have a robust public health system. If you want in the 21st century to have this intersection of public health science, information technology, and public policy, then you're not going to get that by insisting on tax cuts at every turn. It's really simple. You either pay your money or you take your chance. And right now, for those people whose only value is contributing as little as possible to the Commonwealth, that we're seeing the consequences. We have more dead people in this country, absolutely proportionally, than anywhere else in the world. How do you explain that, other than we've just put other priorities ahead of public health?
Right. Let's do another question. So this is from Daniel. I'm sure this will be covered later on, but I'm curious to hear what our panelists think of Apple and Google's contact tracing API and the challenges its potential implementations.
Right. I think that we touched this a little bit. I think, but if anybody wants to take that in terms of the contact tracing and.
I haven't worked on the contact tracing piece, but another industry collaboration we had was around using AI, more users being able to check their symptoms, whether they should go to a health department or become tested. And I think that was a really positive collaboration where we had two huge industry partners who were able to sort of work on CDC's open site and CDC's GitHub on not only showing how our contact tracer runs, which has been used by millions of people, but making that same code be reused by anyone who can then deploy it into a cloud environment. So I think that it's not a giant industry collaboration that helps, through the health communication, but also the methods of it can be directly deployed by anyone who goes and grabs the code and runs it, and they can get that ongoing sort of AI rule set. I think that's a novel thing that I haven't seen in other outbreaks that I've worked on. And I think it shows how we're also having the output of those industry collaborators to be usable by many people.
Apologize for that, everyone. Forgive me. I'm trying to do the best I can to remove these hackers and Zoom bombers.
Thanks, Michael.
Sorry about that, Brian.
You might be able to close the meeting and not allow anyone else in.
Yeah, try that, but
we tried that. Yes.
Yeah. Try that.
We actually do. Yes.
Sorry about that. There's nothing I can do here. Well, maybe we should wrap it up as 5 o'clock. Dr. Sinoramus.
Yep. I think that with that, I would like to thank everybody for participating in this meeting. And thank you for attending, and thank you our panel, Soyon, Brian, and Ken. So with that, thank you everybody, and thank you our panel.
Bye.
Thanks everybody.
Take care.
Appreciate it.
Bye-bye.
All right, I'm going to end the meeting.
Good afternoon.
Okay.